let's take a look at the abbreviations that we have associated with the musculoskeletal system. Again, it's not every abbreviation you may see, but these are our very common ones, and you really should know these. All right, first up, I've actually put an abbreviation here in parentheses. MSK is the abbreviation that we're going to see for the musculoskeletal system. Again, that's a pretty long term, so MSK is a pretty shortened version of that. Again, it is not every potential abbreviation, but these are definitely some of the most common that you're going to see most of the time inside things like your SOAP notes, when you're seeing patients or reports from other healthcare providers. All right, an MRI stands for magnetic resonance imaging, and perhaps you've seen an MRI machine before, but really what's in there is a giant magnet. It is relatively safe, except for if you have metal inside of your body for any reason, but MRI stands for magnetic resonance imaging. CAT stands for computerized axial tomography. So a CAT scan really is using X-ray-like technology with computer imaging, so it puts the picture together in a slightly different way. But it is very similar. A CAT scan, right, is what it's often called, stands for computerized, right, axial tomography. But it's a way to put together X-ray, which is our next abbreviation, XR, X-rays, okay, into more of a 3D picture. A PET scan, PET, stands for positron emission tomography. Again, we're getting this computerized version. Looks very similar to an MRI or a CAT scan when you go in, but it creates this more colorful picture because of the use of computer technology and how it detects different things inside of your body. All right, OA is the abbreviation for osteoarthritis. RA is the abbreviation for rheumatoid arthritis. We discussed those inside of our diseases video, so please go ahead and visit that. FX or FR, it just depends on who you're working for as to which one you will see, but that stands for a fracture, which is just the fancy term for a broken bone. An ortho is the shortened version for orthopedics. So if you're working for an orthopedic physician, we often just shorten that to ortho. All right, let's look at some other of the MSK. DEXA is a type of scan, stands for dual energy X-ray absorptiometry. It is essentially a test that helps us determine how dense our bones are. But if you need to know exactly what it stands for, dual energy X-ray absorptiometry. It's always a tough one to say. All right, CA with 2 pluses. Sometimes it's written as CA, literally the number 2 with a plus next to it, but that is the chemical symbol for calcium. Okay, calcium is important here because it makes our bones strong. ROM stands for range of motion. So if somebody has a muscular injury, they're going to be able to move a joint a little bit less, or if there's a fracture, right? So oftentimes we will say that the ROM is decreased on the side of the injury. So if you see that term, all right, it means that the patient cannot move that particular limb as well as they can on the other side, or as well as it should to a normal range of motion. EMG stands for electromyogram. Okay, these are a series of tests, usually very small needles, that are placed inside of the muscles to tell if the muscles themselves are working properly. The interesting thing about muscles is that it does generate electricity, and so we can pick up that electricity to see if it's receiving proper instruction from the brain, the spinal cord, and if the muscle itself is working through this test of this EMG.